Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.
And I'm Fred Goldstein with Accountable Health, here helping employers look at their employee health benefits programs as well as employee health improvement programs. So, Nick, we're watching nationally. I believe the numbers are going up in almost every single state due to the Delta variant. What do they look like, really? What's happening out there?
COVID-19 kills more people in the United States of America than guns, cars, and the flu combined. That's
Wow.
a lot of people that are still. Uh, uh, this is a real problem, and I think we have to accept that. What is extraordinarily frustrating is we have had not only all the tools that we knew about from almost 100 years ago, but also all the new ones, and indeed the development of a slew of vaccines that are extraordinarily safe and effective, but we're still struggling with this.
Yeah, pretty amazing when you think about it. People keep saying, well, doesn't this mean the vaccines aren't working? But it's pretty simple to figure this thing out. If about 45, 46% of the population is vaccinated, that's about half, but 98% of the infections, or so I hear, are happening in the non vaccinated. It shouldn't, if it were even, it should be even, and it's not. It's been very frustrating to watch this from my perspective.
Right, and we've seen the government come out and say that health emergency of dis and misinformation. I mean, I think that's been true for a number of years. Certainly, some folks online who have struggled and been on the receiving end of some pretty severe and nasty vitriol, inexcusable. We really need to do better. But what can businesses do to try and counter this? Because ultimately, I think even for the people that don't believe in vaccines, we've all got the same intent here, which is we want to get back to some normality, whatever we define that as, back to going to football or sports events, going to concerts, going to work, or maybe not going to all of those things. How do we do that, Fred?
Well, I think it's an interesting question now because we've got, first off, you've got to figure out, does the local government or the state government even allow me to set up various rules or to try and create an environment that I believe is safer? So, for example, if you're in an organization that is not allowed to have a mask mandate or a vaccine mandate for your company, that creates some issues. I think employers really need to look at, number one, what's going on in their community. What is the rate? As we're talking about these two different communities now, the vaccinated and the unvaccinated, and clearly even in northeastern Florida where I live, I think that it's about 45% vaccinated in Duval County, which is Jacksonville proper, but we have some counties to the west of us that are 20%. And so, where is your company? Consider that first and understand what the rate is, and then begin to say, as we're hearing others do, does it make sense for me to maybe take a step back, look at wearing masks at the workplace, and how do I either incent or potentially disincent certain behaviors? And we're seeing some of that from the cruise industries and others.
I think that's a good point. This is not about mandates. This country is not mandating things. I get that. And actually, there's a pretty poor history of mandatory requirements of, these kind of healthcare things. We saw that with smallpox many years ago. But, developing the incentives that work, and different incentives work in different places. We saw that, the big win, sort of, get vaccinated, you could win $1 million, seemed to work in some instances. We found small incentives along the way, maybe just a Starbucks card or giving people coffee. And, to your point, that negative or the disincentive, well, sure, you can still come to work, but we're going to put you in a safer place so that you don't disrupt our work environment. We're going to require you to go through testing. But I think the big driver for me is we really need to overcome this fear of vaccines with appropriate information and an understanding of those individuals and where they're coming from, and helping them understand that they really are safe. They're not just this, wow, we've just created them, we've got no experience. We really do And the data is astoundingly positive, both in terms of effectiveness and safety.
Yeah, it's fascinating because they keep coming up with other reasons why the vaccine might not be good, and it keeps moving to the next one, as we've seen. And this is sort of a typical history. So I would ask people, when you see things like this on the internet or somebody brings something up, go to a source, and you've talked about this, Nick, quite a bit. Go to a valid source, go to the original source of the data and find it there. Try to understand what it means. I can tell you the truth, this vaccine reporting system. So I was on it, on the app, and every day for the first couple of weeks, I got a thing. Am I sick? Have I been to the doctor? Any symptoms, etc.? And then it went to about every week, I think, or something. I'm not really sure what the tempo of that is, but I finally got one that said, have you been to a doctor? It didn't say, have you been to a doctor for COVID? So I answered yes. And it never asked me what it was. And about a week later, I actually got a phone call, and I think they're sampling. And they said, can you tell us what happened?
Hmm.
And when I said, look, this is completely non vaccine related, they said, oh, we'll remove that. But there's still, I'm sure, a ton in there that either don't get the call or didn't answer the call or are not being sampled to determine that those things that happen, the occurrences are not vaccine related in many cases, and that's what people use that database inappropriately, things like that.
I think that's such a great example. The fact that they're now essentially going back and cleaning the data, that's exactly the point about this misrepresentation of the 7,000 deaths, completely inappropriate. I'd add one additional element of caution. This is not easy, folks. And I'll give you a good example. The list of predatory publishing journals that essentially take anything, total junk, and will publish it essentially to allow people to be published. There's a whole history as to why that's even the case, why there's a business case for this, but it occurs. So you can't just say, that's the American Association of conglomerated orthopedists, as an example. I'm making this up, and say, that's a great journal. That must mean it's
Right.
valid orthopedic information. So you even have to go a little bit further. So this is tough to do, but it's, your point is exactly right. Make sure you go down that. And if you don't know, ask some people that you can trust. Consensus isn't always right, we know that, but I think consensus for the most part is following the science here.
Right. And science changes over time. It's constantly evolving. That's the scientific process. And then, consider the fact that look around. How many people have you seen who are vaccinated who are dying? It's just not happening.
Right.
There have been hundreds of millions of vaccines given. So it's just going to be interesting to see how over time this adjusts. I'm a little concerned that even once it gets a full authorization, and I noticed that they just filed apparently today, expecting by January, but it could be sooner, much sooner, depending on the data. I'm sure there will be something else that comes up. And so just be ready that it's going to take a while, but there have got to be some things as employers you consider to create a safe work environment for all of them. And also consider that that employee may have somebody home at their house with an immune disorder, and they are definitely at high risk. So with that, this is Fred Goldstein with Accountable Health. Thanks so much for listening. And if you want more information, please go to accountablehealthllc.com.
And this is Dr. Nick. I'm the incrementalist here with incremental insights for better business, better health.